Hey, this is Mrs. Reichelt, and we are finally done with most of our muscular unit. This is the last podcast for it, so yay, which means we're closer to a test. So, the developmental aspects of the muscular system. When embryos are developing, the muscular system is laid down in segments. So, each segment is then invaded by nerves. So, if you have your muscle, eventually they're going to be kind of laid down at one segment at a time, and then each time they're going to be invaded by nerves. So you have those neuromuscular junctions, remember? And then muscle and nervous system develop very quickly in pregnancy. So this is not similar to the skeletal system, which that started out as cartilage and then eventually became bone. Okay, so next up, your book kind of talks a little bit about muscular dystrophy. So, muscular dystrophy is a group of inherited muscle destroying diseases. It is congenital, so it's passed down, and what happens here is that muscles are enlarged due to fat and connective tissue deposits. So, normally, you have your fibers that are wrapped around your connective tissue, and if you have so you have your endomysium, the perimysium, the epimysium. So you have all of those normal connective tissue deposits, but muscular dystrophy is when you have too much of that fat and connective tissue. Duchenne's muscular dystrophy is expressed almost exclusively in boys, and in this one, the muscle fibers lack the protein that helps to maintain the sarcolemma. And hopefully, you remember that the sarcolemma was the plasma membrane of the muscle fiber, so it's just a different name for it. And then after birth, gross movements or body movements. So if this is our little baby here, after birth, the first types of movements are just reflexes. And then development proceeds from top to bottom. So it starts at the top and then moves to the bottom. So first that means the kid's going to they're going to learn how to control things in their head, and then it's going to slowly move down. And then also muscular control is going to go from a proximal to distal direction. So that means that a kid is going to be able to lift their arm before they're going to be able to pick up Cheerios off of their table or something, okay? So that's what that means there, that it's going to go from superior to inferior, and then also going to be able to do large whole-scale movements before you can do those little detailed movements. And then in mid-adolescence, this is going to be the peak level of development of natural control. So if you feel like you are really uncoordinated, there's not going to be a whole lot of hope for you. No, you can actually fine-tune natural control by athletic training. And then aging, so the amount of connective tissue and muscle increases as you get older, and then the amount of muscle tissue decreases. So it's kind of an inverse relationship. So as you go increasing connective tissue, muscle tissue decreases. The muscles become more stringy, and then also the body weight begins to decline as you have a decrease in muscle mass. And then strength can decrease by about 50% at age 80, but can be offset by exercise. So that wraps up chapter 6.